Let's talk about the basic knee joint anatomy here today. So I've drawn here a structure of the knee so that you guys can understand what all structures are present in your knee joint. So let's start from the basics first. The first thing that you need to remember about your knee joint is that your knee joint is a hinge type of synovial joint because it is filled with synovial fluid. Second thing, what are the actions or the functions which are present in your knee joint? Flexion, extension, and limited amount of medial and lateral rotation. This medial and lateral rotation will be approximately 10 to 15 degrees, and it will mostly be present or only be present when your knee is bent or flexed. When your knee is extended, it's your hip joint which goes into rotations like medial or lateral rotation. Now let's look at the articulating surfaces. So for the articulating surfaces, you need to remember there are 4 bones which are involved in your knee joint: femur, your tibia, your fibula, and your patella. Now your femur has a medial and a lateral condyle, and your tibia also has a medial and a lateral condyle. Your tibia is a medial bone and your fibula is a lateral bone. Now, because of these 4 bones, there are 2 articulating surfaces which are present in your knee joint. First one is your tibiofemoral, second one is your patellofemoral. Now, it's all there in the name itself. When I say tibiofemoral, that is the medial condyle of your femur and the lateral condyle of your femur will attach to the medial condyle of your tibia and the lateral condyle of your tibia. So that's why the name tibiofemoral. Secondly, when I say patellofemoral, it is the distal part of your femur will attach to your patella, hence the name patellofemoral. Now, along with this articulating surfaces, you have a hyaline cartilage which is present between your tibiofemoral joint to prevent the friction between the joints, and it also acts as a shock absorber. Secondly, along with the hyaline cartilage, you have 2 different meniscus which are present in your knee joint. Now it depends on which part they are present. So the one which is present medially is your medial meniscus, and the one which is present laterally is your lateral meniscus. So the blue structures which you see here are your medial and lateral meniscus. Your meniscus are usually C-shaped structures, and there are 2 major functions which you need to remember about your meniscus. Is first one, it provides a depth to your tibial condyle, hence it increases the stability in your knee joint. Secondly, it acts as a shock absorber. Now, one more very important thing that you need to remember here is that your meniscus doesn't have a nerve supply, and your meniscus is attached to your medial collateral. So your medial meniscus is attached to your medial collateral ligament. Now we'll cover that when we come to the ligaments. So let's start with the ligaments first. Namely, there are 4 ligaments which are present in your knee joint, which is 2 collateral ligaments and 2 cruciate ligaments. Now in 2 collateral ligaments, again it depends upon in which part they are present. So the one which is present medially is your medial collateral ligament. The one which is present laterally is your lateral collateral ligament. Similarly, in cruciate ligaments also, you have 2 ligaments. So that is your anterior cruciate ligament, and one is the posterior cruciate ligament. Let's talk about your collateral ligaments first. Now, you have your medial and lateral collateral ligaments. Now, amongst this, your medial collateral ligament is bit more thicker and longer than your lateral collateral ligament. And as I said previously, your medial collateral ligament has an attachment to your medial meniscus. Because your meniscus doesn't have a nerve supply, every time you see a person having a meniscus injury or a medial meniscus injury especially, they will complain of pain which majorly comes from your medial collateral ligament because your meniscus doesn't have a nerve supply. Secondly, the function of this collateral ligament is to prevent the displacement or the translation of your knee joint from side to side and provides more stability. And your cruciate ligaments, which is your anterior cruciate ligament, very popularly known as your ACL, and your posterior cruciate ligament, very popularly known as your PCL. Your anterior cruciate ligament or your ACL will prevent the displacement of your tibia forward, and your posterior cruciate ligament will prevent the displacement or the translation of your tibia backwards. Now, similarly, there are few more other structures which are present in your knee joint, which we'll discuss in the next video.